Director of Public Health and Social Services, and Dr. Felix Cabrera with the Physicians Advisory Group.
Today, I want to begin by offering our sincere condolences to the family of the sailor who passed away at Naval Hospital, Guam, due to COVID-19. These losses remind us that while the numbers we are seeing seem favorable, now is not the time to celebrate. Our concern should be in the long-term trends, and all numbers seem to indicate that we need to stay the course and adhere to our current measures to ensure we are not hit with a second, potentially more fatal wave. Our clearest example is Singapore, a country about the same geographic size as Guam. While Singapore saw great success in the beginning stages of COVID-19 pandemic, it loosened its restrictions too early. And as of 10 hours ago, they reported 386 new cases in a single day. Despite having a much larger population than ours, this is what happens when we begin to declare victory before we have actually won. Combating COVID-19 has required me to exercise my existing executive authority to keep Guam safe. This includes the implementation of public health road closures meant to deter non-essential movement throughout Guam and educate drivers on the risks associated with violating clear public health directives. This is done with the support from the Guam Army National Guard and GPD. We are not the only jurisdiction to implement this measure. Road closures are currently being deployed in North Carolina. The difference between us is violating an executive order during a public health emergency in North Carolina is a Class 2 misdemeanor, which carries a penalty of up to 60 days in jail and $1,000 fine. No such penalty or fine currently exists in Guam law, even though it exists in nearly every jurisdiction throughout the country. So I ask a simple question. If someone knowingly puts your family at risk for COVID-19 infection, could you live with the knowledge that what they did was not punishable by law? This morning, our legislature debated the merits of making a public health emergency declaration more enforceable. While I do not know what they will do, I respectfully ask them to keep that question in mind. No new laws would be necessary if we simply took responsibility for ourselves. I'm sad to admit that my social media accounts have seen numerous examples of those who violated our social isolation directives this weekend, potentially placing themselves and those around them in danger. The effects of these social gatherings may not be felt until 2 weeks from now. This is what we mean when we say COVID-19 is a slow and long illness. Your decisions today, your choice not to social distance may seem inconsequential, especially if you are only looking at the rate of new cases. But this mindset kills people. Human beings have the tendency to overestimate the positives. Hope is a powerful thing, and while we surrender it, our decisions must be based on science and what we learn from those who succeeded or failed. In recent days, I have been cautiously optimistic about our fight against COVID-19. But for many, that fight isn't just about the number of those infected or treated at our hospital. It's about the basic struggle to find a job or keep a small business going. That is why I am happy to announce progress in two fronts. First, we confirmed as many as 20 local businesses have received economic injury disaster loan grants of up to $10,000 each effective today. This money can be used to mitigate the impacts of COVID-19 on your small business, and I understand that more applications are being processed as we speak. Secondly, the Small Business Administration recently notified me that 94 businesses on Guam and the CNMI have qualified for more than $20 million in Paycheck Protection Program money. This means that 75% of these monies, or about 15 million, must be spent on maintaining private sector payroll, including health and retirement benefits or rehiring previously laid off employees. I am told that this is merely the first batch of approvals and that others may be on the way soon. I continue to urge our business community to take advantage of these local programs so that they can keep people employed while we await other federal stimulus payments and programs. I want to thank everyone who worked to bring these benefits in Guam. I know this good news may not help everyone who needs it, but it is a step down a long path toward a stronger Guam. I am continuously humbled by this. I will pause now and have Linda go ahead and give us our CDC update.
Thank you, Governor. Yesterday, we conducted 33 tests, and of those 33 tests, 33 were negative. However, we do have one clinically diagnosed case that is new. So, of the total tests, we did 801 as of March 12, 2020 through April 13, 2020. 685 were negative and 116 were positive. And so just looking at the local cases, plus we have 11 from the U.S. Naval Hospital through the Department of Defense Reference Lab in San Diego, plus 4 more confirmed cases by our diagnostic laboratory services, and 3 clinically diagnosed local cases. That brings us to 134 cases at this time as of yesterday. In regards to the regional distribution of all our COVID positive cases, we have 68 of our COVID positive cases residing at northern region of the island, 42 reside at central region, 20 at the southern, 2 are homeless, and 2 are pending determination. Thus, that leaves us to 134 altogether. In regards to our age group of those that are COVID positive, between the ages of 0 to 9 years old, we have 1. And between the ages of 10 to 19 years of age, 7. Ages 20 to 29 years, we have 13. 30 to 39 years of age, 14. 40 to 49 years of age, 24. 50 to 59 years of age, 25. 60 to 69 years of age, 34. 70 to 79 years of age, 11, 80 to 89 years of age, 4, 90 years and above, we have 1, and that's the total of 134. In regards to our gender distribution, 71 are female, 63 are male. In regards to the medical status of our COVID, 51 are stable, 11 are hospitalized as of yesterday, 4 are in the inpatient unit at GMH, 1 is at the ICU, 6 are at the SNU, and I'm happy to report that 66 recovered, and that is 8 more as of today. 5 deaths, and thus the total 134. In regards to the cases in isolation, we have 28 in home isolation, 23 in the Government of Guam isolation facility, and again, as I mentioned earlier, 6 are at SNU at GMH, 4 are at the inpatient care unit at GMH, 1 in the ICU, 66 recovered, 5 have died. Moving on, the travel history of all our COVID patients. We have 18 that have a travel history. However, 116 have no travel history. And of that 116 cases without travel history, the breakdown are as follows. Household contacts, 35 of them. Community contacts, 13. Healthcare contacts, 19. And of the healthcare contacts, we have 5 as a patient, 14 as a healthcare worker, and we have 49 no reported contacts at all. The quarantine site, we have 180 individuals right now. In regards to the travelers that completed their 14-day quarantine, as of yesterday, we have 20 that have completed, and so altogether 253 have completed from the time we began. The isolation site, as I mentioned, we still have 23 patients there. Of the 66 out of the 134, or 49% of those that have recovered, the age breakdown are as follows. 0 to 9 years old, we have none. 10 to 19 years of age, 3. 20 to 29 years of age, 9. 30 to 39 years of age, 10. 40 to 49 years of age, 16. 50 to 59 years of age, 7. 60 to 69 years of age, 12. 70 to 79 years of age, 5. 80 to 89 years of age, 3. 90 years and above, 1. In regards to those that have recuperated and fully recovered, 36 are females, 30 are males. The demographic distribution of those that have fully recovered, we have 24 that reside at the northern region, 28 are in the central region, 14 are at the southern region. Travel history and travel with the 14 days before the onset, 12 of them. Those have no travel history, however, there are 33, and 21 remains to be determined. In regards to our laboratory, as I mentioned earlier, we do have DLS, and right now 89 tests have been conducted. Thank you, Governor.
Thank you, Linda. I'd like to ask now Dr. Felix Cabrera, who is one of the physicians in my physician advisory group, to give us some information about up-to-date data, maybe. Dr. Cabrera.
Yeah, thank you, Governor. Today, speaking on behalf of the Governor and State Surgeons Physician Advisory Group, we would like to give the general public a brief update as to what current COVID-19 positive cases are telling us in regards to our ongoing projections. On April 3rd, we presented projections that include a range of possible outcomes, including our plausible worst-case scenario. In this model, the projected peak may not be until the first week of June. FEMA's own independent modeling has a projected peak as early as mid-May. Therefore, any discussions on Guam already being past our peak is not only extremely premature, but potentially dangerous. This is especially concerning as there is now growing consensus among the country's experts that COVID-19 has the potential to hit us in waves if we relax our preventative measures too early or too rapidly. Multiple waves, by definition, have multiple peaks. It would be irresponsible for us to believe that we are out of the woods or even close to it. It is very important to note that projections from epidemiological models are actually not meant to predict the future. Judging them as either right or wrong is a misuse of its purpose. Instead, they are a planning tool that describes a range of possible outcomes that are highly sensitive to our actions as a community. We must understand that these actions have significant lag time in what ultimately gets reported as new cases, hospitalizations, or deaths. If we act only on the best or most hopeful projected scenarios, we are likely to end up with the worst case scenarios. If we prepare for the plausible worst case scenarios and continue our resolve to strongly enact our early prevention efforts, we are much more likely to end up with a much better scenario. Lastly, it is important to realize that no country, state, or territory has yet to be over-prepared for COVID-19. If we stay the course and continue our mission, we can be more successful in decreasing the spread of coronavirus and thus saving lives. Thank you.
Thank you, Dr. Cabrera. We're open for questions now.
I'd like to remind the media again that you have one question and one follow-up. We'll begin with I-94, Adriana.
Hi, my questions are for public health. So we just learned that the CNMI received 20,000 test kits from South Korea, and these are rapid test kits that are in line with Trump's request for 600,000 test kits that are expected to arrive in the US this week. Has a request been made for these rapid test kits here?
Yes, I just spoke with my staff and they're looking into it and they are assessing it as we speak.
Your next question, Adriana.
Okay, so my second question, we know the CDC section of public health did an on-site visit of the Department of Corrections after the DOC recruit tested positive for COVID-19. And according to DOC, the investigation determined that 11 officers were in close contact with the DEPCOR recruit. Have those recruits been tested, and what other information resulted from that inspection in an effort to contain any outbreak at the prison?
Yes, the answer to your questions are, we had already our team come in there, our containment team that did that. And yes, we're going to test all of them, and that has already been determined that the deputy director and I made that decision to test all of them. So the answer is yes, we're going to be testing every one of them as soon as we can get them all to agree, because of course this is all dependent upon their approval as well.
Thank you, Adriana. Next is PDN, Jasmine Wise.
Hi, Gov. I had a question about the sailors from the USS Roosevelt. So do we know how many sailors have been moved from hotels back to Naval Hospital Guam after showing symptoms?
I don't know. I do know that they do medical checks every day. I think they do like once in the morning and once in the afternoon. And when they do show any symptoms, they are immediately removed from the hotel and sent back to the hospital for follow-up treatment. So I don't know if that has happened or there are people that have already experienced that. I'm not aware, but I do know their process, and I do know their protocol.
Your follow-up, Jasmine?
Yes, staying with the sailors, I know that you made it a point to say that the Navy and Gov Guam had reached an agreement and that the sailors were going to abide by Guam law, and you were assured that the sailors would follow quarantine protocols. But again, Rear Admiral mentioned that one of the sailors didn't follow that protocol. How clued in are you as to whether or not sailors violate quarantine while they're in the hotels, and how many sailors have been disciplined so far for not following those strict orders?
I do know that the Admiral has informed me that there were 2, I think, that have violated their quarantine, meaning that they left their room. Actually, 1, that they left their room and it was caught on camera, and the person was removed from the hotel and sent back to the naval facility.
Thank you, Jasmine. Next is the point, Nick Delgado.
Hi, Governor.
Hi, Nick.
Thank you so much for the update today in regards to the numbers. A lot of the people in the community have been waiting for that. But the CNMI government, they also received their 36 million, I believe, in the CARES Act funding. So where's Gov Guam now in getting their 111 million share? And will it be used to fill the gap in any revenue in the government? And further, will any of the money be used to help those in need, such as unemployment? And if we don't get that federal government funds for unemployment, the 900 million, how will GovCon cover that?
So we are in touch with the federal government. We have signed the necessary certification papers that is required, and we should be getting our share shortly. As far as unemployment, we are actually on track to get unemployment benefits for those that are unemployed. The other great news that I mentioned, of course, is the pay protection loan, which is related to unemployment, because you are then allowed to write off that portion of the loan that pays for your payroll. However, you have to employ your employees. So in that sense, it affects the number of unemployed individuals. So that's a program also for unemployment. The use of the money is, there are 3 criteria, there are 3 conditions And it is all related to COVID expenses, prevention measures, the measures that are done that cost a cost, which is an unbudgeted cost in your fiscal year budget, and then any expenses that has to do with COVID virus. I do know, Nick, that the governors and myself also, the 50 governors of the 50 states, governors of the territories, are lobbying very, very strongly with the president and also with the U.S. Treasury to allow the use of those monies to be put into lost revenues. Because right now they were very clear that you cannot use it for lost revenue.
Your follow-up, Nick?
All right, thank you for that. And so it just seems like we're just waiting now. It's a waiting game
Yeah.
to get those monies. Thank you so much. And so my second question, you made it very clear in your opening remarks, if someone knowingly puts your family at risk for COVID-19 infection, could you live with the knowledge that what they did was not punishable by law? And so I love that how you stated that to the public, the question that they should remind themselves when being out and about in the community. But now my question to that question that you posed is in terms of, can the community get more transparency when it comes to some of these clusters, some of these places? Because we heard early on about the bingo, we heard early on about some of these other places, but the biggest cases are coming out of these healthcare clinics that we have no idea where people who may be sick for non-COVID reasons are getting treatment or going to seek healthcare attention. Where are these clinics?
You're like coming in and out, Nick. So your last statement is
Where if we can get confirmation on where are these clinics, where are these private clinics, that majority of these cases with healthcare workers and some of those patients coming out of.
I do know that all private clinics are triaging and screening individuals. You know, I don't have information as to which clinic. I think Linda does break that down. Yeah. Which clinics are mostly which clinics are mostly sending the specimens to, and I think you mentioned it, right?
Yeah, what he's asking is the locations of this cluster. So yes, one is a private clinic, the other one is not. The first setting that we have, we were assured that the private clinic addressed that issue, and so that has been already addressed. And right now, your question as far as where exactly it is, we are going to keep that confidential because of the fact that we have done all our investigation already, and our team is already at the point where that clinic has already been all identified along with all their employees, and they've all been tested. And so they're on the verge of almost all being cleared at this point in time.
Thank you, Nick. Next is K57, Patty Arroyo.
Good afternoon, Governor. Thank you. My question is, because the CNMI announced this morning that they are moving the $36 million available under the CARES Act, Guam, you say, has accessed the web portal for that $111.8 million, and when will those funds be available?
So again, Patty, the certification that's required has been signed. I think it's on its way. I signed it this morning, and so it should be already submitted. And once that's signed, we should probably be getting the funds this week.
Your next question, Patty?
Yes, I do. Thank you. Can you respond to the reports out of Korea that there are renewed cases in Korea of patients that had since been recovered and now are testing positive, and the date that we expect to return to normal on May 5th, given that news and the pressure from the Trump administration to reopen business and businesses and from other states that we will get back to normal at least by June. Are you at all concerned about that timeline?
I am concerned about extended timeline, and that's why I am concerned about us being able to recover and to be back into our normal lives. I am very concerned about that. But I am much more concerned that if we prematurely try to lift restrictions and prematurely get back to opening businesses and being as normal as we can be. I don't know if we can ever be normal again, given this pandemic crisis. I would prefer to err on the more conservative side and to be rest assured through medical advice, through science, that the time frame that we are looking at in terms of lifting, which I have not yet had a date. What I would like to do, Patty, is monitor very closely, which is what we're doing now. I'd like to enforce again our preventive measures and even be more strict about our measures so that we can then when we do open, that we don't go back into again being reinfected. That's my challenge, and that's something that we have been discussing. And I know some of the guidelines out there is that if you don't have a case for 14 days, that's a good mark. And also if your hospital capacity becomes back to normal, then you can be assured that quality of care is delivered in a very capacity-wise method, that those are the main indicators of when we can start looking about opening. Also, Dr. Felix Cabrera has been very upfront by saying that when you institute a measure, it takes about 11 to 14 days to see really the outcome of that measure. And that's what we're seeing now. You saw we started on March 14th, and now we're seeing measures along the way that we've done that proving to be positive, to be good outcomes. I want to make sure that the measures that we put is going to continue to be good outcomes. There's no one answer. There's no one concrete guide. We have to take it as the circumstances arise and make the best judgment we can. I will say that if we are starting to lift restrictions, I'm going to lift them very slowly, and I'm going to monitor them very, very closely. And once we start seeing any kind of reinfection, I'm going to go back again and put in the measures that we have put. Again, the experts are saying that this virus comes in waves, and like Dr. Cabrera said, there are multiple peaks in those waves. So it's really a big challenge. It is a big challenge. It's a big challenge for all. Hokkaido, which was one of the hot spots in Japan, they lifted theirs. They had kids go back to school, and now they're getting hot spots again. They're getting peaks again, and so they've reinstituted their measures again. All schools are closed. Kids cannot go to school. So that's what I'm trying to avoid, and I would prefer to be on the conservative side. Dr. Cabrera wants to add something to that.
So Patty, hi. So in terms of your question about in South Korea and these patients who have supposedly recovered from COVID-19 are now testing positive again. And so I just want to clarify that right now what the thoughts are is that one is that we're not very sure of what we're actually seeing in these cases. Is that are we dealing with reactivation or reinfection? And the answer to that right now is that we absolutely don't know. So it's information like that is why we have to be extremely conservative in terms of our efforts, because even though that we're reporting these recovered cases, there's in no way can we assume that they are completely immune from and not going to be at risk of having COVID-19 again. And so that is a scary thought overall, but it's why we're being as taking as much caution as we can, so I just wanted to put that in context.
Thank you, Patty. Next is KOAM, Nestor Lecanto.
Good afternoon, Governor, Linda, Dr. Cabrera.
Hi, Nestor.
Yeah, my question is for the governor. We're hearing from the national media that the economic stimulus checks are already being sent out. I was wondering if you could update us on where we're at in that process, and also on the advance stimulus payments for families with 10,000 or less income.
Yes. The economic impact recovery is the advanced tax rebate, and so we are processing, and we have processed throughout the weekend. Daphne and her team, Director Daphne from DRT and her team, have been working hard all weekend to process it, and she's looking at possibly distributing those checks by this week for sure. I mean, I know it's already Tuesday, but she's working hard to see if we can do it by this week.
Okay, and my follow-up question is, so as you mentioned, the senators are debating Speaker Barnes's bill to put some teeth into your stay-home executive order, and also Senator Shelton is still also planning to pursue her bill, which would authorize a curfew. Can you elaborate on the implications of if they aren't able to pass any of that legislation?
Implications if they don't pass?
Yeah.
Okay, so if they don't pass this legislation, I will not have the teeth behind some of my executive orders. So I will continue with the measures that we are doing now, and I will continue to work within my legal authority to, to put in the measures and to enforce the measures as best I can within my legal authority. I will also continue educating our people. I will also continue persuading our people to please follow the measures. That's the best I can do. I will have all my law enforcement people out there within their legal authority to implement programs that will, again, further educate people to not travel if they don't have to travel, and only be on the roads for essential and necessary business.
Thank you, Nestor. Next is PNC, Kevin Kerrigan.
Half a day, Governor.
Have a day, Kevin.
I wanted to return to the testing again, and perhaps this question is for Dr. Cabrera or Linda DeNorsi. As you indicated, we had 0 positive tests yesterday. I think there was 1 on Saturday, 2 or so the day before. The number of positives has clearly gone down. The number of recoveries is up. But the message I'm hearing from you today is more severe. We need to prepare for more cases. So my question is, if we were to graph the progression of this disease from the beginning, where are we now? Are we still at the beginning on the up curve or the midpoint?
Yeah, hi, Kevin. So at this point here, we're at the extremely early stages of what even our initial projections were showing. And you have to understand that context is that right now we're looking at a very zoomed in portion of that very big curve that was shown. And so really understanding that yes, we may have breaks in the cloud, so to speak, but we have to really understand what's looming offshore, and so to speak. But obviously it's here on Guam, and that even right now, if one patient from every village on Guam were to present at GMH's emergency department with COVID-19 and be admitted, then you're looking at about tripling our current census of COVID-19 cases in Guam, and then we're right back to where we are in terms of even more heightened sense of state. So that's why even though we're seeing these cases decrease, it doesn't give us any real solace, because we know that it doesn't necessarily represent the potential incidents in the community. And that's why with more testing capability, we think we'll have a better idea of that. What public health is doing in terms of the tracing, I can't say how important that is overall, and giving them the ability to do that is so critical, especially in terms of doing what they can to contain. We keep saying that assume everybody else has it, and assume you have it. But the reality also is that what they're doing is extremely, extremely important, and will allow us to continue to flatten this curve.
Yes, and as we develop more and more cases, we do more and more contact investigation. And as we contact all the household and also individuals that they're in close contact with, then we find out, are there others that may be symptomatic? And if so, we obviously test them, and that continues. And then we also try to track, are there more clusters that we are aware of? And that's why it's so critical that we continue our contact and surveillance follow-up to ensure that we have done enough investigation, that nobody is left out, and that we continue the work so we ensure that the community is safe. So there's no transmission within the community.
Thank you. I wanted to ask a question of Admiral Manoni, but I don't see him there today. But I'll ask anyway. We noticed that there are some, what appear to be some medical tents going up around the grounds of Naval Hospital. And I'm wondering if any of you there can tell us about that.
Yes, so there is a contingency of a medical unit that is here, and the tents that they are constructing in the Naval Hospital area is that medical unit, and I think they are increasing their hospital beds there, and also their ICU. I think they're increasing their ICU by 12, and I think hospital beds, I want to say maybe about 50, 20 or 50 more. There is also another bigger tent that they're going to be constructing, Kevin, at the South Finnegadon. And that one is going to be a 120 bed capacity plus another 22 ICUs. And the beauty about that is that it also comes with medical personnel. And so, as he had mentioned yesterday, that also is going to be available for the community once the request is made. So it is a Department of Defense for also civil authority.
Thank you, Kevin. Next is Guam Daily Post, John O'Connor.
Hello, Governor.
Okay, John.
Just to follow up on Nick's question regarding the clinics, you've disclosed other institutions that could be sites for clusters. Hapaday Bingo is being one, Iglesia de Cristo. What makes those institutions different from the private clinics? Why can't you disclose the private clinics?
Governor, do you want me to disclose it?
Sure. You know, John, the key here is that the people that need to know it. Mm-hmm. They are the people that need to do the contact tracing. They are the people that need to do the surveillance. And we're trying to keep as much privacy for patients or even for individuals that have frequented those clinics. Public health has that information. They have contacted the people. I'll tell you, you know, there has been some negative consequences as a result of us even saying the Sinohanya Community Center. And we need to learn from that, because what we want to do is not stigmatize people and not blame out people. You know, our island's pretty small, and you don't need to. You don't need a lot of information to try and trace back everything and connect people to situations and circumstances. So we're trying to keep as much the privacy of the individuals, protect the privacy of the individuals. People that do need to know it to combat, trace, contact, prevent, and so forth are the people that know that information.
Right. And I agree with the governor. Absolutely. I mean, we want to protect the individual. We're doing as much as we can to notify them as much as possible. And yes, we have done our contact surveillance and tracing of them. And I agree that we want to keep it that way. And the stigmatism that has already gone out of what has been already disclosed has its repercussion, and we really want to respect the individuals and their families.
Your follow-up question, John.
Thank you. Now, in anticipation of bills 334 and 335 potentially passing, Governor, can you provide some clarity on how you plan to enforce your executive orders? For example, will we begin to see even more checkpoints on the, roadblocks on the road? Will we begin to see police officers doing neighborhood checks to see that people are not gathering for parties and such? And how will police officers know that people are telling the truth when they are asked about their destination while they're traveling?
Okay, so a lot of what you just said, I think, relates back to trust and responsibility. You know, really, if you don't say the information accurately or in truth, you're hurting yourself and you're hurting the community. And that's the question that you need to answer. Do you want to be that responsible person that causes greater demise for our people here in Guam? And yes, I will put up more roadblocks if I have to. Yes, I will have all our police officers out there patrolling if I have to. Yes, I will have them come out and break up social gatherings that aren't supposed to be there. Yes, I will enforce all of that. Because what is the end here? The end is to save our people's lives. That's the end goal.
Thank you, John. Mariana's Business Journal, Maureen Marakita.
Good afternoon, everybody.
Hi, Maureen.
Hi, ma'am. My first question is for Dr. Cabrera. Good afternoon, Doc. So I don't think anybody expects that we're all going to wake up one morning and the governor's going to announce that we can all go about our business as usual. So I was wondering if you'd be open, or the Physicians Advisory Council would be open to discussing with some of the civic organizations what might be first steps for our business communities, so that there'd be something at that point that the two groups could present to the governor as a logical first step in getting the community back to normal.
Sure. So, in fact, that's exactly what's being planned, and that's what we talked about in our morning brief. And actually, I'll let the governor discuss that a little bit more.
Sure. So, Maureen, I am establishing a panel, and in fact, already the business community is organizing. And I'd like the panel to be, a representative of experts that could come up with a plan. And again, the plan, the requirement of the plan is that we do it slowly and at phases, so that we can monitor each of the actions that we have taken to assure that we are not reinfecting our community again. So I already have, we are way ahead of that. We are already discussing guidelines and what we would be doing. In fact, on Thursday, I'm going to be meeting with the panel and the group that would be put together to provide, again, the advice and the guide necessary to start thinking about recovery.
And so the only thing I'll add to that is that, again, I think it's very clear, and you prefaced your question by this, is that it's not necessarily a question of when, but the question is how will we know when? And so basically it comes down to the forming questions that we on the Physician Advisory Group will really want to be able to answer. The four main questions, and that's number one is, can we continue to take care of patients without compromising quality care, and that they can continue without resorting to crisis standard of care? That's number two is, will we have enough tests to test everyone with symptoms? And then number 3 is, can we continue to do tracings and without compromise and contact tracings of those who are known positive and do that in an effective way? And then number 4 is really just having being clear that these that cases are sustainably going down or absent for at minimum 14 days. And so those are the 4 main things that we have to be very clear and try and answer very clearly before we can even answer, even get an idea of when.
Your next question,
Okay.
Maureen?
Yes. So I wanted to go back. This question is for the governor. I wanted to go back to the comment you made about educating people who are on the road. And I understand that that the Guard have now moved from talking to people to giving them flyers. And so I wonder if that's really the best way to educate people, because the message is getting, I mean, we're all human, the message is getting kind of old. So wouldn't it be better to have people agree that they understand the points that are being made and that their journey, if we are trusting them, that their journey is essential, rather than just having these long lines on the road, although I know that the hours have changed. So
my understanding is they are still educating people that are being stopped, and then they're handing them a flyer also to reinforce their educational information. And I know this because I've gone through the line and I've tested the line. So they're still out there educating. And they're asking them, where are you going? And they're reminding them that they should only be there for business of essential matter, and that they are being reminded to stay home. They're reminded to social distance and so forth. So every opportunity and every method of education is very crucial. We are using social media, we are using traditional media, we are using print media, we are using, Zoom, everything that you can possibly think of to reach out to our community, because they're the ones that are going to help us win this battle.
Thank you, Maureen. Pacific Island Times, Johanna.
Half a day, everyone.
Half a day, Joanna.
Hi, so my question is for public health. So I'm wondering, how soon can the general public all get tested? Like, when can it be open for everyone to get a COVID-19 test instead of just waiting for a physician to recommend them?
Yes, well, we're really moving forward. We just got 2 new machines, the Abbott ID Now, and we're already launching that. That machine is a point of care machine. We're doing 1 GMH, and we're already getting our lab. Our lab will start tomorrow. I confirmed that with them. That's an additional machine aside from the current ABI 7500 that we have. With this Abbott ID Now, they can do 1 test. If it's a positive test, it'll be read within 5 minutes. If it's a negative result, it'll be ready within 13 to 15 minutes. And right now we have about 176 cartridges. We were given a little bit more, but we use some of that to calibrate and validate the machine. We're also in contact with the international research it's called the IRR, which is through CDC, where we're going to get a lot more tests that will be coming forward. And we're anticipating, we already did our orders, and so that should be coming in very, very frequently, and that's going to be a big help. So that's already 1 machine that we have. On top of that, we also have, or as you already know, the ABI 7500. We also have another machine called the Gene Expert. And the Gene Expert, we're expecting 4,600 test kits to come, and that's through the Pacific Island Health Officers Association. And so once we get all these test kits, we can mobilize all 3 machines simultaneously. And on top of that, with GMH already having their machine, then this is going to expedite it. And remember, we also have DLS. And as I mentioned earlier, 86 samples already went out. And so they're also testing for us, and they're getting that done through off island, through Quest in California and our Hawaii extension of DLS that we have in Guam. So all those tests are happening. And as soon as we get them, we're really seeing that it's going to be not too long from now. I'm looking within a week or so that we're going to mobilize all these tests. Once we get that, we can test every single person if we can. And again, the capacity of how fast we can get more test kits is going to be determined as far as how fast we can continue the testing.
Your follow-up, Joanna?
Okay, so I guess my follow-up is about accessibility. So I hear stories in the States about people getting thousands of dollars of like bills just to get the COVID-19 test, not even treatment, just to get tested. They pay thousands of dollars. So how accessible will it be to the public?
It'll be very accessible. In fact, all the tests that are for Medicaid, MIP, and uninsured, they're all going to be covered. MIP, Medicaid will cover it. And also, I'm giving the okay to have them all tested. And so anything that we are going to cover, if anything, the private insurance should be able to cover it. And public health also has an account that we will also work with DLS as we have a contract with them. So it is very accessible. That's the answer to your question.
Thank you, Joanna. And now for some closing remarks.
Yes, thank you very much. I am always humbled by the strength and the heroism displayed by healthcare workers in all of our facilities. In our government facilities, we have public health people there. We have volunteers from my administration there, making sure everything is smoothly provided for our people that are quarantined, for our people that are on isolation. We have our Guam Fire Department, who responds very quickly to the cries for help from people who are short of breath, people that have high fever, people that are very anxious that they are possibly a COVID-19 positive case. We have our surveillance team that's out there working very diligently to identify these people, to test these people so that we can stop them from transmitting to their neighbors, their parents, their loved ones, their nanas. We also have instituted very, very strict measures of stay home, self-quarantine, self-isolate. Our public health people are out there monitoring. We have our police officers, they're out there patrolling, they're out there working hard to keep our people safe, not just from COVID-19, but from other sources of crime and so forth. Then we have our nurses and our doctors, our respiratory therapists, our dietitians, our laboratory people that are sacrificing the well-being of their lives themselves, responding to the call of duty, and making sure that they provide the quality of care that our people so much need and deserve, and giving them dignity and respect. We have all our frontliners out there helping, sacrificing their families and so forth. And I just believe that these are our COVID heroes. I want them to also be able to go back to their homes and have a normal life like all of us are reaching for and all of us are fighting for. And your part is to stay home. They are there working for you. They want you to stay home so that they can continue providing the kind of quality care for our people. So again, my plea and my cry for helping us as a community together fight this continues. And You're probably tired of me saying it, but I will never be tired of saying it. Please stay home, abide by these initiatives, comply to these initiatives. Don't travel the roads if you don't have to. The best vaccine for this disease and this virus is to stay home, social distance, minimize social contact. And I know